also to members of the public and partners who may be joining us online. I just want to start just with a huge thank you, first and foremost to everybody who lives across the North East and North Cumbria. The actions that you take on a day-to-day basis, but also your support for not just the local NHS, but all of our community and voluntary sector organisations and our partners in public services is hugely valued and welcomed. I think a national health service is what it is. It's a service for the nation, for the people that live in our region, and we're here to serve you. I do want to acknowledge that it has been a challenging year, a year of lots of change, particularly for colleagues working in the Integrated Care Board. This is now our third year of operation, and during the course of this year, we saw through our second major restructure, as the Chair has mentioned, and this time next year we'll be talking about our third major restructure, which is already underway. And this is as a result of national policy decisions with regard to both the funding and the shape of services, and seeking where we can to make sure that we're directing resources into frontline clinical care, and becoming more efficient and effective in both the planning and organisation of services. Across our region, we know that people live with poorer health than the rest of the region, shorter lives and more longer term conditions. And our integrated care strategy that we developed some 2 years ago now, working with all of our 13 local authority partners, Better Health and Wellbeing for All, sets out our strategic goals. I'm really delighted over the last year to support the delivery of that. Our medical director led the development of our clinical conditions strategic plan, which really targets the 12 health conditions that will have the biggest impact on people living in our region. And just to pick a few of those, whilst this continues to be a significant area for us, with 1 in 5 people in our region living with and facing anxiety and depression, we have seen a slight reduction in the suicide rate per 100,000 population. We've also seen a 10% reduction in alcohol-related admissions, and we've seen our adult smoking rates fall across our region to 11%. That's a 62% reduction over the last 20 years. And I do want to acknowledge the work spearheaded by our Directors of Public Health, and also FRESH, which is our commitment across the region to make every contact count and really work hard to reduce the smoking rate, because we still know this is one of the biggest causes of premature death in our region. We have unfortunately seen obesity rates rise, and particularly in areas of higher deprivation. So that is a firm priority in our clinical conditions strategy, and we'll also be working closely with our combined authorities, particularly around children and young people in this area, which we see is hugely important, particularly supporting children and young people with their readiness to start primary school. Over the last year, we've developed our plan for people and culture. Why does that matter? Well, we're the single biggest employer across the region in both health and social care, and this is a workforce strategy that we've developed with social care as well as health. And why does culture matter? Well, we see culture reflected in areas of safety, in areas of workforce experience, and therefore having cultures which are compassionate, that are kind, that are transparent, and support people to be the best that they can be in work is a priority of ours, alongside making sure that we're using our workforce capacity in the best way possible. So I'm really delighted that this year we developed that plan working across our region. Some other sort of highlights, reflections of the year. Well, we are seeing record levels of cancer diagnosis and diagnosis at much earlier stages of cancer, stage 1 and 2, which is to be welcomed. We're also offering more appointments than ever in GP practices, and in part that's been the continued expansion of the additional roles working in primary care, but also the significant endeavours of our GPs and colleagues who work in general practice. We know that we've had a real focus nationally this year on access and tackling the 8 a.m. rush, and I was delighted to see the results recently of the annual survey in general practice and see some of our practices score 99% in terms of patient satisfaction. We know we've got more work to do there, and particularly to support both access and a positive experience for our public in accessing services, but really delighted that we've seen capacity increase and be enhanced, and equally also across our community pharmacy. I think if anybody's been into community pharmacy recently and you're not sure about the services that they offer, do ask the pharmacist. We've got record numbers of pharmacies through our Pharmacy First programme now prescribing antibiotics, therefore saving time in general practice, but also extending the access available to services. And our campaign on urinary tract infections, award-winning campaign, I think really does highlight the benefits of that. Also delighted that over the past year and at our board meeting today, we will be talking about our dental plan. We've had a real focus around dental recovery and particularly prioritising urgent dental access, and we've seen our urgent dental access centres open up in Darlington and Carlisle, and we're seeing record numbers of appointments through these services, all accessible through the NHS 111 service. Whilst we are focusing our urgent dental access centres in various parts of the region, I think it's absolutely crucial that we do provide that opportunity for members, for the public in our region when they are experiencing an urgent dental need, that they can access those services in the community. And we've had an additional 109,000 appointments provided through those practices for patients in urgent need. For those of you that have been to the Metro Centre recently, I drove past it this morning, and those of you that will shop there, you may well have come across one of 2 new community diagnostic centres that have opened in the region. I'd just like to thank Ken Bremner, who's our Foundation Trust member on the board, who leads the diagnostic programme across our system, and delighted that we've been able to bring in capital funding and open the community diagnostic centres at the Metro Centre in Gateshead and also on the High Street in Stockton. This is all part of that strategy around rapid, faster diagnosis of things like cancer, and getting the diagnostic capacity that we need for the region, and placing these in locations that are accessible on the high street, that are easy to access, also alleviates the pressure on what are also quite constrained hospital sites. So this is a real welcome step forward, and we look forward to the continued expansion of those. The most recent ones actually opened up over in Cumbria, but that will fall into next year's annual report. We've also, through our housing, health and care programme, had a real determined effort to support people with complex needs in their own home, either through digital technology, but also in life-changing moves. And in the annual report, we illustrate this by talking about a individual case of a gentleman whose name has been changed, but we refer to him in the report as David, who had spent many years in a hospital, a secure hospital, many hundreds of miles away from home, disconnected from their family and in a more institutionalised setting. And through our determined focus around transforming care and experience for those individuals, and working in partnership with a number of organisations across our system, including our 2 mental health trusts and also Every Turn Mental Health, we've been able to bring people like David back to the region, to resettle them back in their own homes, in the community, where they can connect back with their family and friends. And not only is that life-changing for people like David, but it's actually far more cost-effective. It gets better outcomes. And again, I'd like to thank Levi for his leadership over the past year of that. Again, today on our board, we're talking about the Health and Growth Accelerator sites. We know the impact that employment has on people's health and well-being. It is good to be in work, it's good to be in paid work, and it's good to work in good environments. And we know that when people experience a period of ill health in their lives, whether it's physical or mental health or a combination of both, being able to return to work will have not only an impact on them, but also a direct impact on the economic success of our region as well. And I was absolutely delighted that we secured £90 million of investment into our region to support people to stay well and working. And we'll be talking about the work on our Health and Growth Accelerator that we're leading, along with 2 other sites in the northeastern Yorkshire at our board meeting today. It is absolutely focused on getting outcomes. We will have to demonstrate that the interventions, the health and social interventions that we're putting in place will support people to retain their employment and get back into work. We already have good evidence of this across aspects of services that we already provide, but we'll be tracking that carefully over the year ahead. And one of my reflections is that as we transition ourselves over the next few months to take more of a focus on the strategic outcomes and the effectiveness of the services that we are commissioning, being able to track the data and demonstrate that we're getting those outcomes will be really key. Another story I just want to briefly highlight is the story of Margaret. Margaret is one of 500 people diagnosed early through our lung cancer screening programme that we've had underway across the region. Again, another reason why we need that additional diagnostic capacity, and where we identified people to invite them for scans to check for lung cancer. Margaret's one of those people that cancer was picked up, and what that meant was she was able to have the treatment and get back on her bike, and she is still running her small business. And I think that's one of many stories of people who have either had their diagnosis early and had a successful outcome, or had an earlier diagnosis and been able to have life-prolonging treatment. And again, hugely important for us, given the areas of deprivation and the impact that we know that disease like lung cancer has on our region. I do just want to kind of just focus on a couple of other things as you read through the report. We're now in the 3rd year of Boost, which is our learning and improvement community. Anybody can join Boost. It's available online at boost.org.uk. We now have 15,000 members of our learning and improvement community across the region. And through Boost, we have communities of practice, so people coming together of all backgrounds, including members of the public, doctors, nurses, social workers, therapists, to work on particular issues, to share their knowledge and expertise. It's also a learning platform, and this over the last year we've launched our Health and Equalities Academy, and also our Obesity Academy, particularly picking up the need to upskill not only people working in services around the management and treatment of obesity, but also the public. And I think Boost will be something we continue to do in our region, and I'm sure we'll see it go from strength to strength. Delighted that we've continued our 3 women's health hubs, and we've now had 300 people attend our women's health conference, which is has been an annual event really focused on advancing women's health across the region. We are looking to find ways to expand the women's health hubs, and we've had fantastic feedback on these, both from a preventative perspective, but also creating environments where women feel listened to, they're getting access to the diagnostics and the treatment that they need, and not languishing on waiting lists or multiple waiting lists for various symptoms. We've continued our focus on winter planning, and over the past year we mobilised 43 acute respiratory hubs during the months of winter, and that's because we know that respiratory issues do become more pronounced during the winter months, and therefore seeking ways to support people to maintain well but get them access to treatment rapidly, and preferably avoiding pressure in our emergency departments. In fact, this has gone so well that we've now agreed that we're going to commission acute respiratory hubs as a core part of our urgent and emergency care plan over the winter period, and again we'll be touching on that at our board meeting today. And then delighted from a mental health perspective that we've now through NHS 111 have the option for mental health crisis support, and we've also continued to implement our 24-hour mental health crisis texting service, but also what are known as safe havens. And over the past year we've extended the safe havens both into Ashington, Newcastle and more recently Gateshead, and we're seeing that as a model for delivery across the region. And in September the first 24/7 mental health crisis service will go live in Whitehaven over in Cumbria, and that's the first of one of 5 neighbourhood mental health services across England. So that's a fantastic development that our colleagues at CNTW are leading. We've also this year seen our work in life sciences and our partnerships with industry develop, and we've had an innovative new partnership with Boehringer Ingelheim, focusing on chronic kidney disease, and this is about early identification of patients who can get a quicker diagnosis but also the right treatment. And more recently we've also expanded this, working with another organisation around respiratory services, and I think these types of partnerships with industry are going to be, I think, even more important as we move forward over the years ahead to ensure that we're getting our population access to the most advanced treatments available, and of course investing in these areas creates efficiencies when it comes to managing the health of the population and the budgets that we have. And our Waiting Well initiative, which I'm delighted to say got a special mention in the 10-year health plan, it is so good, helped nearly 1,500 patients prepare for surgery. And it is through these types of initiatives, taking preventative steps where we're working actively identifying people who would benefit from support to prepare for their surgery and therefore recover well, which I think is absolutely at the heart of the 10-year plan, and that real left shift from hospital to community and from illness to prevention. And as part of that, we've also worked closely with the Department of Work and Pensions, again through our Health and Growth Accelerator site. I'm just conscious of time, Chair, and I know a couple of my colleagues are going to be talking about the finances and performance, but just to touch maybe on a couple of areas. Optometry, usually parts captured in the word primary care, which when we talk about primary care in the NHS, we are thinking about general practice, we're thinking about community services, dental services and optometry. But in Durham and North Cumbria, we're now providing minor eye care services by opticians, and they're also piloting access to the National Shared Record, and this has been a particular innovation led by our Primary Care Collaborative, expanding access to the patient record and the data to enhance outcomes, but also again another fantastic example of that left shift where people would have perhaps required referral into hospital-based services. We're now actually moving these into more community-based services. We've also put some more funding into neurodiversity, and if I was going to say something that is a particular challenge, not just for us but nationally, but a real priority for us, is the area of neurodiversity, particularly in areas like ADHD, where we haven't quite been able to tackle the waiting lists in the same way that we have, for example, for planned surgical interventions. That's a real priority for us looking forward. But then just finally, another highlight for us this year was our record level of vaccine uptake for pregnant women for flu and COVID-19. And the way in which we achieved that was through our award-winning Trusted Voices campaign, which is using both marketing and communications, but in a way of co-production, actually working with women to design campaigns whereby we can influence and give confidence to the public as to why these are needed. And Chair, if I was to sort of finish just by looking ahead, never to waste an opportunity. We're sat here at the end of July in the midst of summer, and I'm thinking about flu, I'm thinking about winter, and I'm thinking about vaccinations. And if there's one thing I could do to encourage all colleagues working in health and care, and indeed our public, is to please take up your flu jab this year. Please do that. But if I'm just thinking more broadly looking ahead, the recently published 10-year plan that you covered, Chair, in your reflections on the year does provide us with the roadmap over the next 10 years. Inevitably, as we move into the autumn period, and for the first time ever, we'll get a 3-year financial settlement for health services in the region. We'll be thinking through where we as strategic commissioners place our investment over those 3 years to drive the outcomes that we're looking for through better health and wellbeing for all, but also to deliver a health system that's not just delivering the right outcomes, but is also financially sustainable. As I said earlier, and as you've referred to, Chair, we're going through some major change as an organisation at the moment. It will see us reduce the size of the organisation quite significantly, and through the 10-year plan, the development of far more local place-based partnerships, and that real partnership between the local NHS organisations, with general practice, with our community and voluntary sector organisations, and also with our local authority partners who we work so closely with and are totally interconnected in terms of health and well-being, will be absolutely crucial. So I would just summarise by saying it's been a challenging year, but I think in spite of that, we've been able to demonstrate some successes. We have a lot more to do working together, and I hope that we can continue that spirit of determination and compassion that comes through so loud and clear across the North East, North Cumbria, and particularly hugely grateful to all of our colleagues who choose to work in service of their local population in our National Health Service locally. Thank you.
Thank you very much, Sam. That was Sam Allen, our Chief Executive, and I'd like to thank her for her leadership of the team over the last year, which has got us to where she's described, which is an impressive round of achievements. So thank you very much. Turning now to looking at performance and improvement for the last year, Craig Blair, Director of Strategy Planning and Performance, will be presenting on that.
Thank you, Chair. During 24-25, we continued our North East North Cumbria performance improvement journey, despite a backdrop of challenges linked to periods of industrial action and the ongoing pressures as we recover from the COVID pandemic. But during the year, we continued to work closely with all of our providers and partners, including the provider collaboratives, to help mitigate some of the key challenges and issues that they've faced. This included things like the capacity challenges for both planned and unplanned care, workforce challenges, and surges in demand. Despite these challenges, we've continued to perform well with our elective recovery. Sorry, I should have moved the slide forward there. With our elective recovery, and with the best performing integrated care system against the 18-week RTT standard over the course of the year, although our performance was below the 92% constitutional standard. We've also made great progress in reducing our longest waits, with near elimination of the patients waiting over 104 weeks and substantial reductions in patients waiting over 65 weeks. With regards to cancer care, we exceeded national targets for both the 62-day standard and the 28-day faster diagnosis standard. This has been supported by developments like the community diagnostic centres and the continued progress of the lung health check, as Sam's already highlighted today. In relation to urgent emergency care, we've also made good progress, with 78.8% of patients attending an A&E department being seen within 4 hours. This performance puts us well above the 24-25 national standard of 78%, but slightly short of our own target. The level of performance we delivered did, however, rank the ICB 6th of 42 ICBs nationally. At the same time, our GP practices have continued to experience increasing demand, and in 24-25 across North East and North Cumbria, practices delivered on average 1.65 million appointments every month. This is the highest level of access that we've seen reported. Our urgent and community response services also responded to over 70% of referrals within 2 hours. This has helped to ensure that we support as many patients as possible to either remain at home or in a community setting, although we do have more work to do in increasing the number of referrals into these services. We've also continued to make performance improvements in relation to community and broader primary care. Sam's already covered some of the highlights, but they would include things like the increased urgent dental appointments that we've been able to offer through general dental practices and through our urgent dental access centres based in Darlington and Carlisle. Alongside this, our community pharmacies have also increased their capacity, providing over 60,000 pharmacy first consultations and an additional 8,000 consultations for contraception every month. Together, this has helped reduce demand on GP primary care services. We've also supported more people with the greatest need in our communities to be seen, with 79% of people on a GP learning disability register having had an annual health check. This is against a plan of 75%. It's clear that there's more work to do in improving our performance in relation to the diagnosis and treatment of neurodiversity, poor mental health and severe mental illness. And we've made progress during the year in some of these areas. Specific highlights include 70% of people on talking therapies pathways having reported a reliable improvement in their wellness. 69% of people registered as having a severe mental illness receiving an annual health check within the year. And importantly, we've been able to increase the number of young people accessing mental health support to above the 23-24 levels, with over 59,000 young people accessing this type of support. This concludes the performance improvement update for 24-25, Chair.
Thank you very much, Craig. We now move on to the review of financial performance for the year. That's David Chandler, our Chief Finance Officer.
Thank you, Chair. And just a few slides from me on the finances. On this slide there, you can see the three key messages, which is the ICB delivered its financial duties, the ICS delivered its financial duties, and we received an unqualified opinion from our external auditors. And in audit world, an unqualified opinion is a good opinion. That's the one that you want. I'll just dive into those very briefly in terms of those three summary points. If I start with the ICB's financial duties, our first duty is to ensure we do not spend more than the revenue day-to-day commissioning budget that we're giving to commission services from providers. We received just over £8 billion, and we delivered a surplus of just over £12 million, which was used to offset provider pressures, which I'll come on to in a second. The second duty is to ensure that we don't spend more on running costs than has been allocated. So that's for the operational costs of the ICB itself. We were allocated £54 million, and we had an underspend in that space of just over £5 million. The last duty is on capital. The ICB itself generally doesn't hold assets. It's a commissioner, and we weren't allocated any capital funding as an ICB itself, and we didn't spend any money, so we achieved that third duty as well as an ICB. Going on to the wider ICS, and that is the ICB and the Foundation Trusts combined in the North East North Cumbria patch. first duty was to ensure, after receiving £50 million of deficit support funding, that we achieved at least break even. And you can see on the slide there that we achieved a surplus of just over £400,000. And just put that in context, the ICB has a budget of £8 billion. The ICS itself collectively required to save £500 million in efficiencies, which was just over 6%. So to achieve that target of break even was no inconsiderable feat. The final duty there is around capital, and I'm pleased again to report that the ICS as a whole delivered within the budget set by NHS England by region. This slide, I think, is always a good point in the year to sort of show where the money goes from an ICB perspective. Where do we spend our money? And it's spent in a number of areas from a commissioning point of view. The three biggest areas are acute services, mental health services, and primary care services. And primary care covers all aspects from GP services through dental, through pharmacy, and through optometry. This last slide from me, before I get to the summit slide, I just think is a useful one to show you how spending has changed from one year to the next. And I think this sort of data is quite helpful at this level when we start talking about left shift and the objectives of the 10-year plan that's been recently published. So what you can see on here is year on year, you can see growth in three areas especially: acute, mental health, and continuing care. But to provide some context to that, in acute services, we will have had a 5% pay rise. We will have had investment non-recurrently to cover the cost of strikes. And there was also investment in elective services to bring down waiting lists. And that was nationally funding for the last two items. If you look at mental health, you can see a 9% increase. And that aligns again with the pay award, but also strike cover, but also the mental health investment standard. And we're expected to increase expenditure compared to, say, acute services year on year. And that you can see that being demonstrated, I think, on the slide there. The last one is continuing care. You'll see a 16% increase in that. There's two aspects to that. The first one is the living wage. So the cost of providing continuing care services markedly increased in terms of costs and bills being charged to us by providers in that space. But also the number of packages of care, the number of people that we are supporting to live relatively healthy lives outside of hospital. So that hopefully shows you where the money has gone. And I think that's just something we can use usefully each year just to track how we're performing around the left shift that we're expected to do over the next 10 years. So the final slide from me, Chair, is just to say that we did receive that unqualified opinion from our external auditors. That's Mazars. So they basically said that our accounts are a true and fair view, and also, just as importantly, they were satisfied that our processes and controls arrangements to ensure we spent that £8 billion wisely, they were happy that our arrangements were sound and secure. That's all from me, Chair.
Thank you very much, David. I just check now with Claire Riley, our Chief Corporate Services Officer, if there are any questions from members of the public.
I can confirm that we do not have any questions.
Thank you. Well, before drawing the meeting to a close, we've already thanked the many staff and constituencies who have been working with us and our own team. I'd also like to thank the board, 26 people on the Integrated Care Board. The public see them mainly in our public board meeting, which we'll be having another one of those in a few minutes' time. But I would like to remind everybody how important individual board members' role is in ensuring that there's careful stewardship of the very large sum of public money that's made available for health and care in the North East and North Cumbria. They've done that work very diligently and conscientiously, and with a lot of expertise from their different backgrounds and experience. And also, we'd like to thank them for helping to ensure that the many voices that are out there with thoughts and views on health and healthcare and how it should be provided and developed further, they bring many of those views to the table, given their connection into many different constituencies around the region. So thank you to the board, thank you to the executive team, thank you most of all to all the staff out there who are doing such brilliant frontline work, saving lives, improving quality of lives, and preventing unnecessary things happening in the world of healthcare and its complex delivery. So thank you, everybody, and we look forward to seeing some of you in our public board meeting in a few minutes' time. Thank you.